Hello, my name is Brooke Russell, and today I will be giving a presentation on the substance use disorder inhalants. First, I would like to give an outline of my contents. So first, I will introduce the disorder. Second, I will explain the disorder. Third, I will give the effects that this disorder has on the mind and the body. Fourth, I will give the current treatments of this disorder. And lastly, I will explain how a social worker can help a person experiencing this disorder. So first, what are inhalants? Inhalants are invisible, volatile substances found in common household products that produce chemical vapors that are inhaled to induce psychoactive or mind-altering effects. So what do they look like? So they look like everyday, normal household items that you would find under the kitchen sink. So these contain glue, lighter fluid, cleaning fluids, paint or spray paint, felt tip markers like highlighters or permanent markers, air conditioning refrigerant, air freshener, cooking spray, typewriter correction fluid. There's also duster that people use for their keyboards. There's lots of other inhalants out there, but these are just some that I have listed. And some common street names or slang terms for inhalants could be gluey, huff, rush, and whippets. So, how are inhalants abused? Inhalants are breathed in through the nose or the mouth in a variety of ways, such as sniffing or snorting, bagging, which is sniffing or inhaling fumes from substances sprayed or deposited inside a plastic or paper bag, huffing from an inhalant, soaked rag, stuffed in the mouth, or inhaling from balloons filled with nitrous oxide. So, an interesting statistic that I found in the textbook is that inhalants are often among the first drugs that young children use. About 1 in 5 kids report having used inhalants by the 8th grade. Inhalants are also one of the few substances used more by younger children than older ones. So, this inhalants kind of target the younger population. And the legal status in the United States. Common household products are legal and they're available for the intended use. And there have been restrictions placed on the sale of these products to minors to deter youth who try to buy the products to get high. So there's really not much we can do to for children or for people not to get inhalants because we use them in our everyday lives. So the effects on the mind and on the body. So the effects on the mind, inhalant abuse can cause damage to the parts of the brain that control thinking, moving, seeing, and hearing. Cognitive abnormalities can range from mild impairment to severe dementia. In the effects on the body, inhaled chemicals are rapidly absorbed through the lungs into the bloodstream and quickly distributed to the brain and other organs. Nearly all inhalants produce effects similar to anesthetics, which slow down the body's function. Users could experience slight stimulation, feelings of less inhibition, or loss of consciousness. Within minutes of inhalation, users experience intoxication along with other effects similar to those produced by alcohol. These effects may include slurred speech, inability to coordinate movements, euphoria, and dizziness. After use, users could feel drowsy for several hours and experience a lingering headache. Long-term effects are weight loss, muscle weakness, disorientation, inattentiveness, lack of coordination, irritability, depression, and damage to the nervous system and other organs. There are also overdose effects of using inhalants, and users may suffer the loss of consciousness and or death. There's also something called sudden sniffing death, and this can result from a single session of the inhalant. This is usually associated with the abuse of butane, propane, and chemicals in arsenals. Death by asphyxiation from repeated inhalations leads to high concentrations of inhaled fumes, displacing the available oxygen in the lungs, and suffocation, blocking air from entering the lungs when inhaling fumes from a plastic bag placed over the head, and choking from swallowing vomit after inhaling substances. So there are current treatments for this disorder. There were not many, but there is still research being conducted. But there is behavioral therapy such as CBT, and that's cognitive behavioral therapy, and it has been identified as a primary intervention for individuals with inhalant use disorder. And CBT focuses on modifying behaviors and thought patterns associated with substance use. So first, if a client comes in, the social worker could identify the negative thoughts and challenge those negative beliefs, and then develop healthy coping skills, and then we would practice positive behaviors and set goals that address these underlying issues and be able to improve the prevention of a relapse. And there's also research that has been done that has found a medication called vigabatrin, and a study by scientists at Brookhaven National Laboratory suggests that this vigabatrin may block the addictive effects on toluene, which is a common solvent found in many inhalants. So this research indicates potential for vigabatrin as a treatment option for inhalant abuse. So how can a generalist social worker help a person with this disorder? So the first step would be whenever the client comes in to the office, it could be a school social worker, a parent could contact like an outside company, but the child, would come in, and the social worker would then give the assessment and develop an early intervention of what we can do to help this client stop using. We would provide counseling, connect to treatment programs and resources such as NA, AA, a 12-step group, intensive outpatient therapy, or intensive residential therapy, which that would just all depend on the client. And the social worker could also offer family support, because people who abuse or have substance use of inhalants is a younger population, so family support would be for more the minors, and we could get the whole family involved to help the client. The most important would be to educate about the risk of inhalant use. A lot of times the younger population could just be doing it because they've seen their friends doing it and they want to fit in or be cool. They really don't know the seriousness yet of what inhalants could do to your body or to your brain. So educating about the risk of what could happen to them is very important. And then also recognizing triggers and developing coping strategies, so whenever they do have the urge to use inhalants, they could remember these coping strategies and be able to use them. And this is my reference page. I got a lot of my information from the textbook. And then also 2 outside websites where I read about the research on the medication. And then the other website was where I had learned about the CBT therapy, which is very effective for people who use inhalants. Thank you so much.